Hey guys, it's Dr. Victoria Munoz, and as many of you may know, I've been doing a series on low back pain, and I've been doing a weekly video with, different information regarding low back pain and certain treatments that people might receive from conventional doctors, as well as alternative treatments. Last week we talked about steroid injections to the spine and the risks of these treatments. Today, we're going to be talking about surgery for low back pain and alternative treatments to surgery. So, low back pain can be qualified as either chronic or acute. So, chronic low back pain is typically low back pain that's been going on for more than 3 months. So, acute pain is typically something that has been less than 3 months. Now, it's typically been going on for a couple weeks by the time the patient comes to see the doctor. And if you go to your conventional medical doctor, often they're going to offer some kind of a medication, either an opiate or a prescription strength non-steroidal, like naproxen sodium or ibuprofen. And they might prescribe PT. They might prescribe muscle relaxers. Patient doesn't get better. Big surprise there. They come back to the doctor. They end up getting a series of steroid injections to the area, which, as we discussed last week, actually degrades the soft tissue further, which is the reason that you're having low back pain to begin with, typically, not always. Sometimes it's just a sprain or a strain that will heal up nicely with very minimal intervention. But often there is something deeper going on with the patient, and it's my job as a doctor to find out what that is. So some reasons for low back pain, aside from sprains and strains, would be like bulging or herniated disc, spinal stenosis, or degenerative disc disease. And I'm going to kind of touch on these a little bit before I talk about different surgical procedures that conventional medical doctors might do to help to address these issues, okay? So I'm going to grab my spinal model here. All right. So this is the base of the skull, cervical, thoracic, and lumbar, okay? When we're talking about low back pain, we're talking about the lumbar spine, okay? This is anterior. This is the front of the patient. This is the back of the patient here, okay? So the discs, let's explain what the discs are real quick. So the discs are essentially shock pads that are in between each vertebrae. It creates, absorption of shock throughout the spine and ease of movement and so forth. So the disc is essentially, it's round like this, and on the outside of it is a fibrous tissue, and then on the inside, what we have is like a jelly type substance, okay? Now, we want the disc to be intact, and we want that gel to stay in the center. What happens is when the disc is bulging, the disc is still intact, but it's simply moved out of place, and it may be putting pressure on these nerve roots coming out from the spine. So what we have here is we have the spinal cord. As you can kind of see it, this is the back of the patient, back side of the patient. The spinal cord travels through the spinal canal. And then from the spinal cord, we have nerve roots coming out. These nerve roots essentially come out and they innervate the periphery of the body. So they come out from the spine, and like, for example, nerve roots that are coming out from the cervical spine up here would be innervating my arm. Any nerve roots coming out from the lumbar spine would be innervating the lower part of my body, my legs, my pelvis, and so forth, okay? So if that disc is bulging, like I said, it's still intact. It's just moved out of place and putting pressure on these nerve roots, okay? Now, if the disc is herniated, that's a worse problem, and it's a little bit different in that fibrous tissue has come apart like this, and the jelly inside is actually oozing out through the tear. So there's actually a tear in that disc, and that is a worse problem than a bulging disc, but again, it will put pressure on these nerve roots and cause pain that often radiates down one or both legs into the glutes or whatnot. Okay. Now, spinal stenosis is basically the formation of bony spurs that actually put pressure on the nerves. So it's often due to wear and tear. There may have been a previous injury early in life that never healed properly. And what happens is we get the formation of additional bone, and the canal that the spinal cord travels down starts to narrow like this, okay? And putting pressure, constricting the cord. Also, through these facets here, where the nerve roots actually travel through, there can be additional bone growth, which puts pressure on these nerves. So that's spinal stenosis. It's actually the overgrowth of bone that puts pressure on nerves. And then degenerative disc is pretty much what it sounds like. We have discs in our spine, and when this disc starts to degenerate, the disc height will shorten. And whenever I get my MRI report back, it will tell me the disc height, and if it's shortening, that means the disc is degenerating. And again, you'll also have pain on these nerve roots, because what happens is, as this disc shortens, the vertebrae become closer and closer together and start putting pressure on those nerves, okay? So that's kind of a basic rundown of, some of the problems that cause chronic pain in the low back. And if you go to your orthopedic surgeon, they're going to have some surgical options for you, and I'm going to talk about those and some of the risks of those procedures, and so that you, as a consumer, can make better, healthcare choices. So let's talk about the lumbar laminectomy. All right. Lumbar laminectomy is a surgical procedure that's performed for the purpose of stenosis, spinal stenosis, okay? And it's meant to alleviate it, okay? That's the goal. And spinal stenosis is caused, like I said, by degenerative changes leading to the enlargement of the facet joints in the back of the vertebrae, and also that spinal canal, okay? So these are also known as bone spurs. If you've ever heard of bone spurs, it is the overgrowth of bony tissue around those nerves that's causing pressure. And the nerves actually become inflamed and very painful, okay? So, places pressure on these nerves where they exit the spine. And the lamina are the small flat bones in the back of the vertebra. So when they perform the laminectomy, they're removing part or all of the lamina. Let me just show you on my model here. So these flat bony surfaces in here, that's the lamina, okay? And you can see it's very important for the structure and support of the spine, and it also protects the spinal cord. So they basically remove all or part of the lamina at the affected level of the spine, okay? So, in the lower back, what the lamina does is protects the cauda equina. The cauda equina is a nerve bundle that travels from the lower portion of the spinal cord, and it basically innervates the pelvis, and it's responsible for urination, defecation, and function of the genital organs. So the rationale for performing the lumbar laminectomy is to relieve the compression of the nerve roots, offering them more space. All right. What the surgeon does is he creates a 2 to 5 inch incision along the midline of the low back, and next the right and left erector spinae muscles are dissected off the lamina on both sides. So what we have is two very strong muscles that actually travel the full length of the spine, and it's called the erector spinae because it keeps our spine erect, okay? And they dissected off the lamina on both sides, and then all or part of the lamina is removed at the affected level, and the facets may be undercut, to allow room for the inflamed nerves to heal. So the paraspinal muscles are then sewn back together, covering the laminectomy site. So they basically separate those paraspinal muscles. They actually take saws and they cut out the lamina, and then they put those paraspinal muscles back together and stitch them in place. So, and the reason that the surgeon does this is to allow space for the nerves to to relieve pressure off those nerves so that they can heal, okay? So, so basically, I guess my question to you is, what do you think the long-term outcome of the surgical procedure is? Well, you know, we're cutting away 1/3 of the bony structure that supports the spine and the, you know, the upper body, and this leaves the low back susceptible to further injury in the future. It's kind of like, you know, like I said, you know, you're removing structures in your house. They're supporting walls that cannot be removed in a home. You know, you may remove them at first, and they may offer more space to move around, but eventually that house is gonna crumble. So, you know, what orthopedic surgeons will do is they'll boast the high success rate of these procedure. If you're reading about lumbar laminectomy in any kind of orthopedic journal or magazine or any kind of article, they will tell you that there's a very high success rate of this procedure. But what they fail to tell you is that you will have worse problems down the road. Just give it some time. And so this is what happens. In fact, that is exactly what happens. About a year after surgery, the patient will begin experiencing worsening pain of the low back. And that is because supporting structures, very important supporting structures, were removed from the spine, exposing the spinal cord, and ultimately leaving it vulnerable and susceptible to further injury. Plus, you know, the only reason they do this is to relieve pressure on the nerves so they can heal. Trust me, there are better options, okay, than this very risky surgical procedure. Another procedure that orthopedic surgeons will perform is a discectomy, okay? And this procedure is done basically to alleviate low back pain due to a herniated disc, okay? Might be one or more discs that are herniated. They'll basically just take the discs out, okay? The discs are present to provide shock absorption, like I was saying, for the spine and its structures. So once removed, your spinal cord and surrounding nerves are left susceptible to injury. And as a result, the surgeon might need to go back in and place rods and plates along your spine for support. Basically what this does is it creates chronic pain and limited mobility of the spine, and it can lead to it can lead to some pretty serious disability of the patient. So that's low back pain in a nutshell. So what are alternative options that you as a patient can seek? Well, regenerative medicine offers safe, effective alternatives to these risky procedures that, you know, only leave you with chronic pain and disability for the absolute rest of your life, okay? People come to me, I've had patients come to me that are considering surgery, and they want to know what the alternatives are, and I've had, you know, patients go and do the surgery because insurance covers it. Well, I'm sorry, but, you know, it doesn't matter if insurance covers it or not. You're looking at a life of disability and chronic pain for the rest of your life. You know, I mean, if you're 80 years old, that's one thing, even though I don't think any 80-year-old should lose their quality of life any more than a 30-year-old should. But if you're 30, 40 years old and you're choosing to go have one of these surgical procedures done, you're looking at, you know, the rest of your life having chronic pain and some serious issues, okay? Regenerative medicine, you know, is getting people their quality of life back. Did you hear that? Let me repeat that. Regenerative medicine is getting people their quality of life back, okay? You can live a full, functional life with regenerative medicine. Low back pain is the number one reason patients seek medical care for pain. Low back pain is the number one, okay? I think knees are number two, shoulders are number three, but low back pain for musculoskeletal issues is the number one reason people seek help from their medical doctor for pain. We've already talked about some of the treatments and the alternatives that conventional medical doctors will provide. Will recommend. You know, we've got opioids, we've got steroid injections, we've got nerve ablation, and then we've got surgery. None of them fix the problem. In fact, it makes it worse. And I've had patients come to me who were prescribed opioids, never had addiction problems until they were prescribed opioids by their medical doctor, and they had to go through rehab as a result. So that's really kind of the sad state of conventional medicine. So if you're experiencing low back pain, regenerative medicine definitely has the answers. In a previous video, I talked a bit about some of the treatments that I do for regenerating soft tissue injury. And to be honest with you, there's really no level of injury that can't be helped with regenerative medicine, unless it's like, we won't go into too much detail, but I've treated some pretty serious cases that have gotten better, okay? So we've got prolotherapy, which is kind of the low-level first level treatment, okay? Then we've got PRP, which is basically we draw the blood, draw the plasma, the protein-rich plasma off the top. We inject it into the area. Has growth factors in it that are very highly regenerative and can repair soft tissue damage. The big guns, obviously, is stem cell or allograft. I do the allograft. It comes from mesenchymal stem cells. It's highly regenerative, and that's very effective treatment. It's one and done, and I have a 98% success rate with these treatments. My patients do get better. So sometimes when I treat the patient, I use a combination of these three solutions for a better outcome. Just depends on what I see with my patient, depends on what the MRI report says, depends on what physical exam tells me. And by the way, naturopathic medical doctors are experts in physical exam. We're probably the best at it because we actually do hands-on with our patient. We actually do orthopedic exams. We assess the situation in great detail. I do myself for this reason, that I want to make sure that I kind of understand the pain pattern before I order imaging. For example, I want to know if, for example, just quickly, we have L1, 2, 3, 4, 5, okay? But then we have T12 up here. Now, T12, if T12 is affected and I only order an MRI for the lumbar spine, I might miss something up here. But if physical exam tells me that there might be a problem above the lumbar spine, then I also need to order a thoracic spine imaging. So, patient might be having pain in their hip, and I'm not going to go into great detail about pain patterns because ortho exams will tell me a great deal about what's going on with the patient, because pain patterns tell us a lot about where the level of injury is. So my patient may be having hip pain. Now, is that hip pain related to the low back, or is it actually a secondary issue with the hip itself? So I may have to order a lumbar and a right or left hip MRI. So physical exam is very important. A lot of doctors don't do physical exams on their patients. It's one of the first things I do to know how I'm going to move forward with treatment. So physical exams, orthopedic exams, MRIs, they all give us information about what's going on with our patient. Once we have this information, we can, myself as a regenerative medicine specialist, I can determine what level of treatment that I want to do on my patient. And I try to be as conservative as I can with the best possible outcome. So if my patient needs PRP, I'm just going to be upfront with them and say, you know what, we could probably get you better with PRP. My patient just needs Prolo. We're going to say, let's try a series of Prolo first to see how you respond to it. If the patient isn't responding, we might move up to PRP, okay? So this is kind of the way that we go about, treating the patient and getting them better with, the kind of minimal treatment with the best possible outcome. Now, the allograft obviously is the big guns. I can treat any patient with the allograft and they will get better. And so my patients just say, Doc, I don't care. I just want the allograft. I just want it to be one and done. And I want to be, I don't want to be, coming back for the allograft later if that's what's needed. So, but typically I'm pretty good with my physical exams and my assessments to know exactly what kind of treatment my patient needs. So hey guys, that pretty much sums up, back surgery, the risks that are involved with back surgery, why physicians choose to do back surgery. And one thing that I think it's important to understand is the reason your orthopedic surgeon is recommending surgery is because that's what he's trained to do, okay? He's not trying to deceive you by any means. You know, he doesn't know anything about regenerative medicine. They don't get paid to tell you about regenerative medicine. They're just telling you what they know as trained physicians and what they're willing to do for you. So if you go to that kind of doctor, that's the kind of recommendation you're going to get. If you come to a doctor like me and you need surgery, I'm going to recommend surgery. Sometimes surgery is needed for various conditions, and we're not going to go into that right now. You know, that's something that we would obviously I would obviously talk to you about at your first patient visit if you did need surgery for some reason. Like, for example, if you have an ACL tear, we're talking about the knee now. If you have a complete tear of the ACL, it will need to be surgically repaired, but the stem cell, the allograft is still indicated for a full recovery because nobody ever recovers fully from a surgical procedure unless there's something regenerative that's done in addition to that. So, hey guys, I'm Dr. Victoria Munoz, and if you're having back pain, please come see me. I can get you better, and I do offer a free 15-minute consultation. What the consultation is, it's typically something we can do over the phone. If you have more questions about regenerative medicine, it's kind of like a meet and greet. This is what I do as a doctor. If you have specific questions about like Prolo, PRP, stem cell, allograft, we can discuss that, and then you can make the decision to move forward with getting treatment. You can find me at drvictoriamunoz.com. That's my website. My phone number is in the description, 602-429-9561. And hey, that's a wrap, guys. Also, go like my page, Regenerative Sports Medicine and Anti-Aging. That's the name of my medical practice. And I do upload articles and important information that is absolutely free. You don't have to pay a doctor for that. You just go to that site and you check it out, and you learn about different things about, back pain, joint pain, and regenerative medicine. And, I think it's important that patients educate themselves. I offer this educational material so that my patients can be educated and make good choices for themselves in terms of what kind of treatments that they, want to move forward, and what kind of care that they are going to get from a naturopathic doctor like myself. So, hey, I'm going to sign out, and I hope this was helpful. This pretty much ends the series of our back pain videos. And I haven't decided what I'm going to start next week, but there's going to be a weekly video that kind of gives you information about regenerative medicine and how it can help you. So, hey guys, you have a great night, and have a great weekend, and I'll see you soon. Bye-bye.